Dr. Jones, OBGYN and mom to 4. Today we're doing the next episode of OBGYN Reviews, YouTubers' birth stories, and watching Aspyn and Parker's recent vlog of the birth of their sweet baby girl. Hopefully we will be able to pick some things out of it that we can learn about labor and delivery and pregnancy.
Because I don't want to go and get sent home. I just would rather like know for sure, but then it's kind of like, how do you know? So the rule is, what they told us is that it's supposed to be, you need to come into the hospital when your contractions are 5 minutes apart, lasting 1 full minute for an hour. So I started timing probably like an hour, hour and a half.
This is a common concern that people have. They don't want to go in and get checked out if they might get sent home. To that I would say, if you're feeling like this might be labor, then it's okay to go in. Most labor and deliveries have a triage unit where they can monitor you and check and see if they think it's actually labor. The way that she said that she was told to go in is similar to what I tell my patients, and I say the 5-1-1 rule, which means if you're having contractions that are 5 minutes apart, they last 1 minute each, and that goes on for 1 hour, then that's probably contractions we'd want you to come in and let us check out. That doesn't mean those are the only things you should come in for. It also doesn't mean if they are further apart than that or different than that, that you can't come in. It's always okay to call or come in, and I would say if you're sitting around going, I don't know if I should go in or not, then call the nurse line or call your doctor and find out if they would recommend that you would do that.
It's just like not what I thought. I just don't know. I would rather just come in and like have the information of them saying like, no, this is not it. Go home. It's gonna feel like this. So I think we're gonna go in.
Walking in, putting on her chapstick. This may be the last moments before we have a baby.
What is with all these YouTubers being freaking adorable walking into the hospital? When I went into the hospital, I looked like I had just rolled out of Frankenstein's basement and I was acting like a crazy person. I am so amazed by these birth vlogs with such lovely people in them.
You go too late, you can't get the epidural. I'd rather just like check.
Yeah.
It is true that if you get there too late, you sometimes can't get an epidural. That being said, and somebody who's having their first baby, although it does happen, and I'm sure you guys will comment below if it happened to you, it's pretty rare for someone who comes in with the desire to get an epidural and gets there too late to get it. Now, the more babies you've had, the more likely that is to happen, but it's still relatively unlikely. Most of the time, people who want an epidural will show up at the hospital in time to get it, especially with their first baby. But it can happen.
Ben is now in her gown again. Seems like it's just getting worse because like she was like having a hard time standing up. I had to help her stand up. So we'll see. They're sending a nurse in right now and we'll get a further update.
So right now they're in a labor and delivery triage room. It looks like they have laid her on those pink and blue straps and they're going to put those around her. One of them will be attached to a monitor that monitors contractions, and one of them will be attached to a monitor that monitors the baby's heart rate. And then probably, my guess on what they will do is watch for about 20 minutes, make sure baby looks happy, see what her contractions are doing. There's a whole lot of ways that a triage workup can go, but for the most part, this is an accurate representation of you go into the hospital, you let labor and delivery know you're there, they take you to a triage room, which usually has a bed like this and some monitors, and then they evaluate, and either a doctor comes to see you or the nurses call the doctor and tell them what they're seeing, and they make a decision on should we admit you or should we send you home and tell you to come back if the contractions continue, or should we say just follow up with your doctor at your regular prenatal visit, and that all depends on what the situation is. It looks like she's getting admitted, so she must be in labor, which I think we could have figured out because it's her birth vlog. This is a labor room, at least I'm guessing it's a labor room, so you can see it's a little bit bigger. She's in a bigger bed. That bed probably breaks down to be a delivery bed, and they're kind of getting things settled, and baby's on the monitor. You can hear the heartbeat in the background.
Now, another contraction? Yeah. Okay, you let me know when it's over, okay?
And those look like more labory contractions.
First thing we're doing is give you a little numbing shot. Here's the bee sting. Worst part. Try not to move. You're doing real well. Okay, you concentrate on the contraction. I'll concentrate on this part. Well, we're almost done here.
She has gotten admitted and now asked for an epidural. The person in those green scrubs is likely an anesthesiologist, and he's come in and gotten her set up in seated position where she's curled over, And the reason is you want access to the right space in the vertebral column to be able to put the epidural in. An epidural is put in by usually using some local numbing medicine, which is a teeny tiny needle that they use to inject numbing medicine in the skin. And then they place the epidural with a very long spinal needle, but it's still a relatively small needle. It's long, but the gauge of the needle is relatively small. They place the epidural and it leaves a catheter in, kind of like you would leave in an IV. Epidurals don't really run out. If the medicine runs out, they just replace it like you would an IV bag. I'm sure an anesthesiologist could explain this much better. Christina Braley is an anesthesiologist not too far from me and made a great video about this not too long ago. You can go to her channel and check that out.
Checked Aspyn, and as soon as she checked her water broke. And then she said she's a 6.5. They came in and gave her epidural, and we're off to the races. We are having the baby today.
I thought for sure we'd go home. I felt like stupid coming in because I didn't want to get sent home.
Yeah, she's feeling a lot better. She's got an epidural in now.
First off, no, you don't, Aspyn. You look beautiful. Second, that's a great explanation of why, if you think that you might have started having contractions and you want to go in, just go in and get checked. She was managing her pain extremely well. She was doing great. And she went in and got checked, and it was labor, and they got her admitted and got her an epidural, and now she's comfortable, and hopefully we're on the way to having a baby.
I would have expected it to be more painful.
Yeah.
But I know that it gets more painful, so props to all you people.
Should have just tried for a natural birth, huh?
No, I don't.
I'm just joking. Yeah, so that's your update. What?
She's like, no, I'll pass.
At
a 7.
At a 7?
Feels so much better with the epidural. Did we already talk about how I threw up? I wanted to stop. I didn't even want in and out, but it's like really close, and so I was like, oh, I guess we can like stop there. And then it was just hurting so much that I was like, okay, let's like not stop. And I ate 2 nectarines.
I love that she's putting on her makeup. That just shows like how her anesthesiologist did such a great epidural, and she's comfortable, and that is excellent. And then she's also talking about how she threw up, and that can happen sometimes in the process of labor, just from hormone shifts, from discomfort, from pain. Just the process of labor itself can make people feel nauseated.
You got it. You got the push. Go, go, go. 6, 7, 8, 9, 10. Let it out. Let's do one more. Go, 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 go. 3, 4, 5. That's her hair right there, Parker.
Oh my God.
That is your baby's hair.
So it looks like she's ready to start pushing, and I just wanted to talk about this little scene here because you can see a lot of important things in the delivery room. I bet this is the nurse that she's pushing with, and they're practice pushing to see how well she's gonna push. Sometimes we'll do that, and then if you think someone's gonna push very efficiently, then we'll go ahead and get everything set up and everyone who needs to be in the room. If we think someone's gonna push for a long time, then you may wait and just push for a little while before you do all of that. It kind of depends. Sometimes people, if their first baby, don't push very long at all, and sometimes people push 3 hours. It really depends on the person, on the baby, on the position. Lots of things at play there. And then you can see in the background they have a warmer, which they will put baby on at some point. That probably also doubles as a scale, and they will weigh the baby there. Then right behind them, you can see a table covered with a blue drape, and that's probably just all of the things for delivery. Clamps to clamp the cord, scissors to cut the cord, basin to put the placenta in, things that you may need in the course of delivery.
Hey guys, she asked if I wanted a mirror, and then they brought in this. I thought it was gonna be like a little hand one, but it's this big mirror. She said it's good because you can have like motivation to see that when you're pushing it's actually doing something, but you saw her hair?
I saw the baby.
We also have mirrors in our hospital if people want them. I would say it's hit or miss. Some people really want them. Some people want nothing to do with seeing that on themselves. And I think either of those is valid. Whatever you want, we will try to accommodate. And it can be, for certain people, really motivating to see the progress they're making as they push.
I'm not convinced that anything's gonna come out. But it's just not.
I bet it does.
I didn't even get to really take an official last belly pic.
Oh yeah. We didn't do the belly cast.
Oh man.
Oh, dang it.
So I've seen people do these belly casts. What do you do with it after that? If you've done a belly cast and you have it at your house, comment down below what you do with it. Is it like an art piece, decorated, or just like in a closet? I find them interesting, but that's a big piece of plaster. Where do you put it?
Deep breath and right back at it. Go, 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 go. 3, 4, 5, 6, 7, 8, 9, 10. That's it. You fell in.
I love whoever her doctor is. We've got the lights down in the room, calm and collected. This is how I like deliveries to be also. There's several people in the room, but everybody has a job. Nobody's talking and having side conversations. It's just calm, quiet, lights are dim. Most of what we do at the time of delivery is done by feel. We don't need a bunch of bright lights, and I don't personally like to have big spotlights on unless I need them. So I love this.
3, 4, 5, 6, 7, 8, 9, 10. He's right there. Oh my gosh.
Good job,
Just like that.
Good job.
So cute. She's already
I know.
Sorry.
She pushed maybe an hour or less, it seems like, based on the timeline that they've said, and they have a sweet baby girl.
Does it feel real? Oh my gosh, she is so cute.
Watermelon that Lauren just brought us. Brought Aspyn some fettuccine. I got a pizza.
I think my favorite part of these is seeing what their choice of first meal is, and she chose fettuccine and watermelon, which I personally find to be an excellent choice. Great choice, Aspyn. I think I need to go get some fettuccine right now, actually.
I'm ready to start getting my bed put together. This is the couch. This is my bed for the night. I think that it folds into a little bit of a better bed, doesn't
It
it?
actually looks a lot like the hospital I trained in. So those beds are super uncomfortable, but they do pull out for a support person to be able to stay in the postpartum rooms. And that's probably where they will spend the rest of their labor and delivery experience until they get discharged home. Congratulations, you guys. She looks so happy and beautiful. They both look so happy. I love this birth story. Thank you guys for sharing it, for letting us learn from it. If you're new here and you like this video, give it a thumbs up. If you're not subscribed, please hit subscribe. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.